How to spot a slipped disc and what to do about it. One of the most common forms of back pain, a slipped disc will affect as many as 60 to 80% of people in their lifetimes, according to aboutHow. Also known more technically as a herniated disc, this condition can be painful and normally affects the lower back, causing pain in the legs. aboutHow explains that your spine is made up of a series of stacked bones known as vertebrae. Each bone is cushioned by discs that protect the bones from shock and daily wear and tear from walking, lifting and twisting around. Causes. Healthline explains that many times a slipped disc occurs with age as the outer ring of the disc becomes worn, torn and weak, and the soft inner part of the disc slips out. A herniated disc can also be caused by certain movements like twisting, turning or lifting heavy objects. Individuals who are overweight are also at a greater risk for a slipped disc because their discs have to support more weight than they can often handle. Weak muscles from little movement or exercise can also increase the risk for a herniated disc. Symptoms. While there are some common signs and symptoms to look out for, sometimes people don't experience any symptoms and have no idea they have a disc problem. Most herniated discs appear in the lower back, but some occur in the neck, and herniated discs can be painful for some people when the ruptured disc irritates nerves that are near it. The Mayo Clinic says the most common symptoms include arm and or leg pain. Because many herniated discs happen in the lower back, people might feel pain in their thighs, calves, feet or glutes. Shoulder and or arm pain. If your herniated disc is in the neck, you might have pain in your shoulder or arm. Numbness or tingling. Sometimes people experience a numbing or tingling feeling in part of the body that is served by the nerves affected by the herniated disc. Weakness. You might experience a weakness that causes you to stumble, or you might have trouble lifting or holding things in your arms. If you recognize any of these signs of a slipped disc, make an appointment with your doctor to talk about your symptoms. Treatment. Many times a herniated disc can be treated with pain management, according to the Mayo Clinic. This might include over-the-counter drugs, cortisone injections or even muscle relaxants or narcotics as prescribed by your doctor. Your doctor might also suggest physical therapy to help manage the pain, like heat and ice treatment, electrical stimulation or short-term brace. In severe cases, a doctor would recommend surgery. If pain medication or physical therapy don't improve the symptoms, a surgeon would most likely remove the part of the disc that's sticking out and causing the problems. Only in the most severe of severe cases would an entire disc have to be removed.